Hello and welcome to Athletic Therapy Now, a podcast for athletic therapists by an athletic therapist. My name is Ashley Burr and I will be your host. Thank you for joining us today. All right, welcome to Athletic Therapy Now. Today for episode 18, we have Katie Mitchell. Katie is a clinician, scientist, educator, and consultant. She is a certified athletic therapist and registered physiotherapist, currently working as a postdoctoral fellow in the Center for Sport-Related Concussion Research, Innovation, and Knowledge at the University of Toronto. Her research is focused on concussion, neurocontrol of movement, and digital health. She has over a decade of experience in concussion care and high-performance sport, and currently is the team therapist for the Canadian Women's National Para Hockey Program. She's also a member of the Concussion in Para Sport (CIPS) international group focused on developing equitable clinical tools and guidelines. So thank you for joining us today, Katie.
Thank you so much. I appreciate you going through that bio because there's way too much in there.
No, you do a lot. It's all good information. It helps us get
It's
to know you
true, a lot
better.
of hats.
Yeah, as every AT, right? Can you tell us in one sentence what your favorite thing is about being an athletic therapist?
My favorite thing about being an AT is the opportunities to meet some really fantastic people and also kind of see the world at the same time in a number of different ways. In one sentence, I guess. But I think for me, my AT network is like my primary network, I think.
That's great. Yeah, that you made it a one sentence there. But you really do get to you get to meet a lot of really interesting people and really great people, and if you want to, you can see a lot of the world as an AT. So that's a lovely thing about it. So, what inspired you to focus your career on concussion care?
Well, it's interesting because it started out basically as a student with the aspirations of becoming an AT. During my undergrad, uh, circa late 2000s, when we didn't really have uh, any really firm grasp of what to do with an athlete who had a concussion. And at the time, as a student, I worked with youth sports, with men's rugby and women's CIS hockey. And so both were like, high frequency of injuries, particularly with rugby being such a compact season. Injury rates are high, collision, obviously, in a collision sport is high. And all I had was this like cardboard cutout of a scat two, I want to say maybe, and zero guidance really from anyone kind of above me to necessarily know what to do in this scenario of even removing an athlete from play. Like that's how far we're going back. Of now we have safeguards for those things where a referee can remove a player from a rugby game. Uh, a friend of mine has done really fantastic research to develop those types of systematic changes. But at the time, I was really sort of stuck in that. And I think just seeing those injuries manifest in players that I knew after working that certain teams for 2 to 3 years, like you start to build relationships and you start to notice when people are acting different. And, when they start having more trust in you and sharing things with you that maybe aren't as obvious like during the field, like on the field of play. And so, not really having like I felt like I guess like really limited and very like helpless in that sense of I didn't have much to justify to a coach why an athlete shouldn't be returning to a game, let alone like to play the next weekend. Uh, and it wasn't necessarily any coach's fault at the time. Like I said, we didn't have any information to guide us. So that really kind of lit a fire in me to understand that better. And I'd always been interested in neuroscience, always really did well in like motor control courses and biomechanics and things along those lines. So, I really wanted to become a therapist. And so I ended up pursuing AT and going to Mount Royal University in Calgary. And At the time, it was a 1 year like postgraduate certificate that I did, and so I continued to work with very high risk sports in like football. And now you're introducing a totally different way of tackling, and you see more fractures versus ligament sprains, and but the same kind of rate of concussion. But I was now working with youth as well, so it was even a little bit scarier seeing a 12-year-old get an injury just as much as a 20-year-old. So those questions kind of carried forward with me, and uh, I had a really strong interest in neuroscience, so that's really what led me into doing physical therapy. There's a ton of redundancy across the board with the MSK portions, but at the time there wasn't a lot in the curriculum for concussion management, again because 2011 we just didn't have that information. So I really dove into kind of like the fundamentals of just neuroanatomy, neuroscience, neurological rehabilitation with stroke and more traumatic brain injuries through physical therapy. And again, like those are always my favorite kind of like placements, as well as the patients that I worked with. I still very fondly remember the people I worked with who were post stroke or had an acquired brain injury or maybe a spinal cord injury, something like that, where um, those were just the most, yeah, those people always stuck with me, I guess. You kind of always have those types of people.
That's great. That sounds like there's so many different things in there that just kept pushing you towards learning more about concussions. And I graduated I did a practicum, maybe my first or second football practicum in 2010. And that was right around the same time that, or maybe shortly after that, that concussion movie came out
Hmm.
with Will Smith. And so I feel like that was kind of the timeline when coaches started to learn more about it and hear more about it and understand it a little bit more. But even prior to that, yeah, like I had it, or at even that time, coaches would come up and be like, "Come on, it's just a concussion. Like it's just a bell ringer, and we can throw them in." I used to go in. That's my favorite line. I used to go into teams or into sports like that. And you're like, "Wait, well, look at you now. Like, is that really? Are you setting a good example
Exactly.
there?"
Yeah.
Um, yeah. So what are some common misconceptions about post-concussion care within the therapy community now?
I think, obviously, and you really nailed it on the head, like the timeline really like kind of followed us along. And that's really when that research started to boom. I would say I've seen graphs where you see the actual trajectory of the literature and how it increased exponentially kind of between that 2012, I want to say Zurich meeting, all the way to 2020 and the 2022 Amsterdam consensus meeting. And so I think we actually have a lot more answers. So there's not a lot of misconceptions when it comes to the guidelines themselves. I think one of the biggest misconceptions, and this sort of followed in parallel, was this boom in like concussion education and thinking that you had to have this like certification in concussion to treat concussions. And what really, for me, like the most I've learned about how to work with individuals with concussion actually came from other places. Like I said, learning about doing like fundamental neuroanatomy, neuroscience, motor control, cognitive neuroscience, biomechanics, and doing like things really specific, like vestibular rehab, right? So, like, those domains are all made up of all these really niche areas that I think instead of doing this sort of compilation of what a lot of the information exists publicly, what really people struggle with are those like individual clinical domains and how to tailor things in that direction. So, taking a really good just vestibular course, it doesn't have to be particularly concussion because you're going to apply those principles the same way. And so I've always been hesitant to kind of call courses concussion courses because I think they apply to now what we learn about ACL injury rehab is now they're starting to say that you need to work on cognitive training with ACL cases. So I don't think I can tease those things apart anymore. So I find that to be one of the biggest things that people always, are in my DMs asking, what concussion course can I take? And I was like, well, I think you're saturated in like concussion information. why don't you seek like another area, like maybe your strength and conditioning could be better and you could apply that to, concussion care. That's exactly like basically my answer every time.
And that's so funny because I think that applies to literally every single case or area where somebody comes in and it's like, "Well, what courses can I take to be better at concussions?" Right? Where's a concussion course? Where's a pregnancy course? Where's a pregnant or a postpartum course? Where's an ACL knee course? And it's like, well, like, you know all the information. It's just about putting it all
Mhm.
together and understanding it more. And I love that you said that it doesn't have to be a concussion course and that it can be, a vestibular course and that will run across more than just concussions.
Exactly. Yeah. Way more value in that.
Yeah, I think it's kind of a sales pitch to say like, here's a concussion course because then it pulls in specifically those people who want that.
Yeah, it's like a buzzword, and really through the mid 2010s it really blew up, and so everybody, is slapping a sticker on their door saying they are certified in X. But then, beyond just what was provided in that, what used to be very, I think, just a checklist based approach, people really struggled. And that's when they came to me going, I still kind of struggle with these cases. And it's like, well, have you actually dove into any of those specific areas to learn about those things? And so I think that's where the gaps lie is, yeah, just diversifying a little more.
Yeah, absolutely. So that kind of goes into this next question that I have for you, where, we talked about how athletic therapists do receive this foundational training in concussion management, which enables us to work with clients who've experienced concussions. At what point would you recommend that an athletic therapist, with just their, university education on concussions, refer a client to a specialist with more advanced expertise?
Yeah, and so I think, as I mentioned before, the evolution from when I said, like, when I was in ET school, the curriculum has evolved so much, and obviously the research has evolved with that. And so things have obviously, they're much more like entry level. The practice involves a lot more knowledge, because there's just more available. I think for me, I always have like referral sources on my bench because I you know, because I talked about the diversity of, say, concussion care in general. There's no one that's going to be an expert in every one of those things. Like you could dive way deep into vestibular rehab. You could dive into cognitive behavioral therapies or something along those lines, or just focus on exercise. But really, there could be something that emerges that is not in any of those categories or doesn't quite respond to anything. So I think when you start to hit those plateaus, and it doesn't necessarily have to be just like a concussion expert, it could be just a different professional altogether. So I worked closely with an optometrist at the University of Waterloo throughout my PhD, Dr. Christine Dalton, and I would often refer to the brain injury clinic at Waterloo for when I was doing. I understand vision to a pretty good level, but there is a certain point that my clinical expertise is surpassed. And I just think, you know what, we need to just have vision assessed a little more in depth. They do a much more rigorous assessment at that level and they do like full eye exam, everything. So that's not something I can do. And similarly, like neuropsychology, like I'll refer to a neuropsychologist at certain points. I think understanding, where like the path different like sort of I guess adjunct clinicians that can help in those areas, and knowing who's local for you is really important. Or maybe it's a colleague who just has more experience in a certain area. You can always just refer. I co-treat with a lot of different colleagues who are fantastic clinicians, but they hit a wall and they just want to work together and see how we can help both support someone. So I've done that in the past as well. And I love working with other people. I think that sometimes we get really kind of in our silo and a little bit competitive as well, which is in our nature, I think. But it is something like is really humbling to work with others and sort of admit when you have perhaps don't know the answer to something. I think maybe being an academic that has helped me do that more often.
Yeah, I think that the further I get into my career, the more that I'm comfortable. referring out. And now I have this like, if a client comes in and it's something that I'm not super familiar with, like I might do a couple of research article reviews and see how I feel about it. But I have a rule where it's like a 3 appointment rule. If we're not seeing
Hmm.
the changes we want to see, then I'm referring out to somebody else who I think might be able to help with that client. And so is it kind of the same with concussion care?
Hmm. Yeah, and I think what's even starting to emerge in literature now is looking at sort of these neurological conditions that can be associated with concussion that are really complicated. And so when a case drags out to a certain amount of time, start to wonder what you're really managing. And then again, you may have to just take a step back and look at the global view and sort of evaluate maybe, what would be the best approach. Sometimes I actually just in some cases with concussion care, you sometimes need like I call them like therapy vacations or just clinic vacation. Like just don't come in for like a month and just see and we'll regroup. Um, maybe it's just the amount of care they are receiving is a little over the top and they're doing all these things and nothing's working because it's just all at the same time. Like if I send someone to vision therapy, for example, I sometimes just put a pause on progressing anything on my end because they're going to be like intensive focusing more of their energy into that. So I don't want to be any confounding factors either. But it is sort of with experience that you start to learn and sort of pick up on those instances where you know where you could actually serve someone by stepping back or like you said referring onwards. I think that is something that's hard to do in the beginning because you don't necessarily want to being newer. I feel like you can have that you already feel like you don't know enough. But yet at graduation, I feel like you probably know more than most therapists would say now and 10 years in. So, if someone sends me like a hand, I just don't treat hands. Like I'd never really liked treating hands. So, I always kind of prefer that onwards. But yeah, I think it's part of experience and again like developing self-confidence and awareness as a clinician.
Yeah, that's great. Um, and so that kind of gets it that answers the next question of like, I mean, all of that answers the next question I had for you, which was, if somebody was interested in specializing in concussion care or advancing their education in this field, what steps would you recommend? And I think you answered that by saying, like essentially find where you're noting a gap in your knowledge and then learn more there. And it doesn't necessarily have to be a specific concussion course, but maybe more, looking at vestibular therapy. Did you have any recommendations on specific courses or styles of courses that could help with that concussion care?
Yeah, for sure. Like I obviously too, I really like conferences for that purpose as well. One, like you can get a bit of diversity, but I think that you can learn a lot of the more novelties that are going on if you're sort of reaching that again, like more on the ends of like, I guess both ways, because you may even find interest for your own career by going to a conference. So I think conferences are underrated and there's a lot of value of being at a conference and learning what's going on in the world of research and practice. Um, I'm kind of biased to courses because I have a course platform and I think we just do a nice job of like being practical about it. And um, Sonia Voven she's the vestibular expert, I would say, between the two of us. And so she has her course online and I think she just does a really nice job because we've both received like training as educators too. And I think that's one thing sometimes limited when you go to a clinical course is that the instructor isn't necessarily taught to teach. And so you sometimes end up in these really didactic courses where you're sitting in a clinic and watching slides for hours or then you split and you do your thing. So I think she does a really fantastic job of applying concepts and demonstrating things and really keeping up to speed with stuff. Um, my own courses are kind of just in renovation period right now because I need to redo them all so and update things because research updates so quickly. So I am currently kind of working on getting those back out. But I think that there are a lot of really good courses, like just in general, like you can find them on the Cato website. Um, but certainly, again, like looking outside the box a little bit and seeing what opportunities are there. Maybe you can learn from an S&C coach. Maybe you can learn. It doesn't necessarily have to be another AT. It could be different professions and getting different insights. So, and lastly, I would say find a mentor who is doing what you like to do, and reach out to them and try to learn from them as best you can. I would suggest that sending a cold message or an email asking for a lot of things right off the hop before really getting to know someone can be a little overwhelming. So um, I would, just sort of, maybe it's following someone in social media and you can kind of learn from them there and interact that way. A lot of people are very happy to help out younger clinicians or early career clinicians or students. Um, I think it's again something that has maybe disconnected us a little bit with social media, and where I could back in the day, like I would email someone or call someone, whatever, who I just was interested in what they were doing and wanted to learn from them. Whereas now I find that to be a little bit harder to do. So um, yeah, I think those three things like conferences, seeking out courses, and maybe not massive courses, they can be webinars or small ones, free YouTube videos, um, and seeking mentorship from someone who's been in the game for a while would be the third one.
That's great. Thank you. And I've got your, or I'll have your website linked in here. So if anybody's interested in looking into your courses when they're up and running, is that on your website?
Yeah, yes. The vestibular course is currently open. My course is more focused on kind of connecting that brain and body, like sensory motor control, cognition, movement coordination, and those kinds of things for sort of sport performance necessarily. More focused on that for both MSK and concussion conditions. So I ran that course from 2020 to I want to say 2022 or early 2023. So I need to got buried in research for a while, so I need to get back to it and finish the revisions. So
Yeah, that's great. Thank you for sharing that. And then just lay it out very clear. What's one key strategy or approach that a therapist can incorporate into their session when working with clients recovering from a concussion?
listening well, I would say, is probably the clearest
I love that.
thing, because again, there's a lot of guidelines and a lot of checklists. But if you're not listening to what someone is telling you about what they're experiencing, you're going to skip over it and you're just going to start go through your list. And then you're not really going to have the answer near the end. But sometimes I've actually spent entire assessments just talking to people. And I do telehealth assessments as well. And I can still come up with a plan despite not doing some of maybe the tests that are recommended. But you can learn a lot by talking and listening and asking good questions.
Yeah, listening, I think, is a very undervalued part of our scope and our ability to treat as therapists. That's great.
For sure. Yeah.
Was there anything else you wanted to add in today before I go through a quick recap on this?
Yeah, I think I don't know if I really described this well, but I think where like an AT really like for me, I think there is still a lot of gaps in the concussion management strategy, particularly in the later phases of that. And that's where I really see the expertise of athletic therapists shining the most is a lot of therapists can get someone to, like sort of everyday basic activity levels, get them there, but there is this gap between basic daily life and return to sport performance that I feel like an AT is like the go-to person to do that. Um, there's other kind of professions that do have sport specific training as well, but I think just inherently we have this ability to return people to sport, return to exercise because that's like kind of S&C mixed in with our profession. And exercise is such a powerful tool with concussion that I think our knowledge is, I don't even think the research really captures it yet. So I think it kind of holds it back a little, but I think the one like if you have a really strong exercise knowledge and you just get a firm grasp on some of these sensory integration ideas and cognitive pieces of how to build that in, you can really, yeah, do some amazing things, I think, with that part of the rehab process.
That's awesome. I was listening to a podcast, To the Bone by Shelby Daly in the United States. She's an athletic trainer, and somebody had said that athletic trainers are like the martial arts of therapy because it's like a little bit of all of the different practitioners out there just put into one. And I completely agree that, AT is really meant. I mean, we can do the, getting people from not being able to do anything to their daily activities, but where we really specialize is getting them beyond those daily activities and to their peak performance. And I don't think that we use that knowledge to our advantage enough.
Yeah, and, like, I do feel like that first initial phase, like, definitely, like, I think I just see it like ATs are really the only profession I think that is trained to go from that start to finish line. You know what I
Yeah,
mean? So, a lot of other professions can sort of do the similar stuff in those early phases, but it's really those pieces that take it over that, is where we can really differentiate, and so I think, yeah, there's so much potential there. I think it's really cool, and some of the work that we're doing in research is gonna lean in that direction, so, I hope it just, boost the profession even more, to provide those opportunities.
that's great. I hope I look forward to hearing more about that. So I'm gonna go through a recap of what we've talked about, and if you think of anything, or if I misunderstood something, just let me know. And so we started by talking about what inspired you to focus your career on concussion care, and it was really just your experience as a student and maybe even a new grad where you were working with a lot of high risk, high impact sports, and you felt like you weren't really sure of what the right protocol was, or you knew what it was but you needed more to stand on, and we just didn't have the information out there, and the coaches didn't feel there was enough information out there to really hang their hat on. So that eventually just led you into really diving into concussion, along with just generally being really interested in, I'm just going to use the brain and the nervous system. And so, and then that carried us on to talking about misconceptions in concussion, and you said that, we've grown so much, and the information has grown so much, especially in the last, 15 years, where a lot of those misconceptions aren't really there anymore, because we have learned so much, and there is so much public knowledge available. And then we got onto talking about when we should refer on. So, as an AT with basic understanding in concussion management, it's the same across the board, whether you have that basic information or whether you've taken those continuing education that will help you with maybe a little bit more, but just generally referring on once a client plateaus, or if you think that there's an area that could be worked on to help the client more, and you have a colleague or a specialist or somebody else that you think can help guide them further, to get past that plateau. And then getting into talking about different courses that athletic therapists could take if they wanted to have a better understanding or learn more about concussion care. And you kind of talked about this throughout, but finding different courses that include the different areas of concussion care, so strength and conditioning or vestibular. And then you had mentioned that Sonia, is it
Sonia,
Sonia?
yeah.
Sonia
Yeah.
has a vestibular course, and I think that's on your website. That can be found on your website. That will be
Yeah,
attached
it's
in the
through,
show notes.
yeah, the it's short form is CNS Ed, or CNS Education is the platform, and so Sonia and I are both instructors, on the platform, yeah.
Perfect. And then you have your courses, which are currently being revised, but they'll be available again soon, hopefully. And then finding a mentor and not just attacking them with emails, but engaging with them on social media and building up that relationship, and then starting to learn from them that way. Um, and And then I asked about one key strategy or approach that clinicians can use if they're working with clients who are recovering from a concussion. And you had said, listening well because it's highly underrated thing that we can use. We all can listen to our clients and learn more and pay attention to what it is that they're really telling us versus just going through our checklist of things that we want to go through with our clients. And then taking, our scope of practice as athletic therapists and using it to our advantage to really take clients instead of just getting them to those ADLs, but getting them back into sport because as ATs, that's what we specialize in and that's what we're good at and that's what we know above and beyond every other practitioner out there. Anything you want to add
Yeah.
to that?
I think too, just to like, because I know that we talk about like athletic therapy is for everyone. And I want to make sure there's no kind of misconception of understanding that, you know, returning to sport, returning to exercise, it could be really anybody across that like spectrum of activity. Because oftentimes, it's someone will come to me a year after they've had a concussion. They could be a middle aged adult, they just want to get back to doing like maybe they were a cyclist or maybe they like lifted weights just like to stay healthy. And their rehab didn't include like a goal towards that. So now they've actually adopted more sedentary behavior. So that's the kind of thing I'm thinking about, just not just in the high performance environment, but it's, that piece that we know so well that could apply to so many groups too, that it could be really, like I said, applied more diversely to the greater populated, more general population, as well as those like high performance environments.
Absolutely. Like I've got clients that are just and this is my favorite kind of client is the client that, they have their 9 to 5 job, but then
Mhm.
they like going cycling on the weekends or skiing or, I had a guy come in today and he's leaving next week to go jump off a helicopter and go skiing. And it's like you're an
Yep,
athlete. They don't consider themselves
exactly.
athletes, but they are athletes. And if that person had a concussion, then they'd be losing a big part of who they are. Um, and and we can help our clients get back to where they want to be or guide them to get back to where they want to be, whether they're, average joe who's works a 9 to 5 desk job and does sports or activities, or whether they're elite athletes. Yeah, I'm
Yeah,
glad you brought
100%.
that up.
Yeah.
Great. Can you tell us where everybody can find you? And I will also link that in the show notes.
Yeah. I try to be social on Instagram. You can find me. My handle is at Thrive Neurosport, or you can find me on like LinkedIn. I don't really use other platforms currently, but you could email me as well. So you can include that as if you want as well. Lots of students and people I've worked with, kind of they follow me those through those channels, and I do try to educate through those channels as well. So, even if you're just interested in some different topics, happy to spread the awareness, but also don't mind responding to the odd message, for people who are just interested in sharing similar interests like that. So, um, yeah.
That's great. Thank you so much for joining us today, Katie, and I look forward to chatting with you again soon.
All right. Thanks so much for having me, Ashley.